Hello, my name is Amy Stiffarm and I am Aani from the Fort Belknap Indian community in north central Montana. I'm also Chippewa Cree and Blackfeet, and I'm the director of the Native American Initiatives program at Healthy Mothers, Healthy Babies, Montana. My background is in Indigenous health, and my knowledge up until this point is a combination of my own personal lived experience along with my experience over the past few years working with tribal communities, and most recently from pursuing and attaining my PhD in Indigenous health from the University of North Dakota. What we were trying to do with this project is meaningfully include the 7 reservations in Montana in an online statewide resource guide. This resource guide is called Linking Infants and Families to Supports, or LIFTS, and it's meant to help pregnant and parenting families find resources, including mental health and substance use supports. But we quickly realized that we needed to better engage and include tribal communities in the process. So we set out to learn more about the unique needs and the strengths of Indigenous communities, and ultimately make the resource guide more accurate and relevant to the tribal communities. So the population of interest in this paper is the 7 reservations in Montana, and the staff of the program serving pregnant people and families with children age 0 to 3. And we also encourage them to invite others with experience relevant to these resources, including community members and elders. This work is really important because although Indigenous women and birthing people are hardly represented in the data, we know that there are higher rates of perinatal mental health complications, such as postpartum depression, within our populations. For many reasons, including the lack of relevant data for Indigenous women and birthing people, initiatives in the perinatal mental health field tend to be based on Western perspectives alone. The current literature shows that as a society, we're not valuing traditional knowledge in the perinatal mental health field, and that's a health equity issue, and it's making it really hard for Indigenous women and birthing people to get help that's related and honors our unique worldview. Indigenous-led, community-driven interventions to improve perinatal mental health need to be better supported through funding and research. We know that tribal communities contain strengths, and it's well documented in other topics such as youth mental health. This paper outlines how we were able to include resources related to Indigenous culture in the resource guide to support perinatal mental health. In this way, families seeking support on the reservation can use our guide to access strengths like therapists and pediatricians, etc., from the Western perspective, but also Indigenous cultural strengths like parent language classes or other cultural programs. More recommendations are coming out about engaging tribal communities to address these inequities, but there's not very much information out there on how to meaningfully and ethically engage tribal communities for this work, especially from an Indigenous perspective. We wanted to share an example of what we learned in this project in hopes that it will be helpful for other groups looking to do this type of work in the perinatal mental health field. I'm really grateful for the opportunity to share this work. If you'd like to learn more, you can read it in the April issue of Health Affairs on perinatal mental health and well-being. Ginihayan, thank you.